Hello, I'm Dr. Mike Milligan. I'm here with Joel Blixt of SomnoMed out of Denton, Texas. They have the SomnoDent oral appliance. Joel, thanks for being with us.
Thanks for having me, Doc.
We're here at the Aesthetics Conference, and I interviewed Tony Swallow about this, and now I'm going straight to the source. Joel, tell us a little bit about the SomnoDent oral appliance.
Well, I'll tell you, the SomnoDent MAS is our answer to treating OSA, or obstructive sleep apnea. We're a company that is a type 2 medical device company.
Okay.
We were launched in Sydney, Australia 7 years ago.
Okay.
Come to the United States nearly 4 years ago.
Okay.
And we've basically built a network of dentists that are delivering our medical device to treat those patients with OSA.
Okay.
And
it's a great service. There are a lot of people out there who need this.
Yes, sir. Yes, sir. There's millions of people are undiagnosed or underdiagnosed, and a lot of the screening that takes place starts with the dental office. And educating those doctors is what we do with our SomnoMed Academy, which is our education arm. And then as well, we're looking for partners. And our partnership starts with our dental sleep medicine starter kit. For those doctors that are looking to bring a new treatment into their practice, that are looking to help those patients that are suffering from OSA,
right.
It's an opportunity to have an effect on their overall health and improve those relations with the patients. And the SomnoDent MAS is considered the most durable and comfortable and effective solution other than continuous positive air pressure or CPAP therapy.
CPAP. And I have my mother and I have a brother-in-law on the CPAP machine, and it's, you know, they don't like wearing that thing. So this is a great alternative.
This is exactly the device that should be used or recommended from sleep physicians for those mild or moderate patients. When we talk about severity of OSA, there's mild patients, there's moderate and severe cases. When they stop breathing for longer than 10 seconds, that's called an apnea. And I think a lot of folks may not realize that when you don't breathe for that long, it has a detrimental effect not only on the heart, but the brain and the vascular system.
And this can be long-term if let go.
Oh, yes, sir. This is really helping those patients that are having health risks, such as possibility of stroke or cardiovascular disease, get that good night's sleep, help the body regenerate in that deep sleep, and get an effective therapy for something that's not as intrusive as continuous positive air pressure or even intrusive as surgery. So there's millions of folks that could use it, and raising awareness and screening patients is where we're starting.
Great. So you say there's a kit that comes, or how does this come about?
Well, we're looking for partners, and our commitment to the doctors that partner with us is, number one, we're going to deliver our dental sleep medicine starter kit.
Okay.
And for lack of a better term, our business in a box is how we can get started and implement in the office. It does include 3 prepaid cases that the doctor can use for patients. It includes some of the things we see here in front of us, including our SomnoMed 6 questions, the certificate, demonstration model, brochures, multitude of support. But the real value in our dental sleep medicine partner kit is that the return on investment isn't long term. The return on investment is in the first couple cases, and it starts with
that's good.
Yeah, when we're talking about a $2,000 investment, to deliver the appliance, you're looking at right about that price to the patient, and it helps.
So the kit's $2,000.
Yes, sir.
That comes with all of this, and you said, did I hear you right, 3 cases as well?
3 prepaid cases with a value of over $1,700 themselves.
And that's the cost of the dentist. To the patient, you're looking at about $2,000 each.
Yes, sir.
For a wonderful service.
Yes, sir.
That's where it all starts.
In
a wonderful service. So you've got your money back right here.
Exactly, and I think the real value is with the on-site consultation. Myself or one of my colleagues will come to their office and help coach their team and implement processes that can identify those patients and get them the help that they need. And when the patient realizes that the dentist is the one looking out for their overall health, they trust their dentist a lot more than they trust their family doctor sometimes. And it's a way to really strengthen that relationship.
Many times.
Yes, sir. Yeah. And the value, at $2,000, that's some skins in the game, and that's a commitment from our dental partners. And our commitment back is to get there and help them implement and get traction and start helping those patients that could really benefit.
Well, that's fantastic. So $2,000 for the kit, and so you get through with that. What about the future then? You've got all of this. You can, I'm sure, get more brochures. we take some impressions, we send it, and a bite, we send that to your lab,
Yes,
I
sir.
suppose, with a prescription, and then you make the appliance. And after that first kit, we'd probably send this to your lab for a new appliance. How much is an appliance?
The cost of our devices, our classic acrylic device is $509.
Okay.
And then our BioFlex material, our SomnoDent Flex, is $559. Both of these products are very unique because they are both handmade.
Okay.
And so there is quite a bit of labor involved, but as well they're very durable. And durability designed to last 5 years with proper patient care. And they also come with a 1-year warranty. And that's unique not only in the medical device area, but in oral appliance in America as well. The appliance itself speaks for itself, I'd like to say, because it's not a lot of adjustment when you deliver the appliance.
That's what I've heard. That
Yeah.
They just go, and I'm going to be doing this soon, but they go right in, very simple. The assistants or the hygienist does a lot of the education, and it's really a minimal time procedure for the doctor with a very good return on investment.
Yes, sir. Yes, sir. And the opportunity really to help those folks that, you know, are in their circle of patients and their staff, the team with the implementation meetings are really where the traction takes place, and they start thinking about patients that they hear complain about CPAP. They think about patients that have some of those visible symptoms and could benefit. And really it's a matter of, you know, let us help you gain some traction. There's no minimums or maximums that you need to do. It's really help those patients and let us help you get started.
Even if the hygienist just said, do you know of anyone with a CPAP, or you know, do you in your family or you know of anyone that does? I mean, that'd be a great way to even just get started with it.
In really asking those questions, those patients that are coming back for their 6-month checkup, 9 months, you know, adding a question when they come back to visit. Have you had a sleep study since you last visited us? Okay. And you're really identifying that diagnosed patient and able to help them if they're not using the therapy properly.
Great, great. How do we get more information?
Well, you can visit our websites at www.somnomed.com, as well as our continuing education with SomnoMed Academy at somnomedacademy.com.
Fantastic.
And you could always call our number at 888-447-6673. It's 888-443-SNORE. And happy to help you out. We have a great team, and it's something that I think more people are finding out about, and we're happy to help them.
It seems like it's growing.
Very much so.
The need is growing, and
yes,
the diagnosis of this is growing.
The SomnoDent MAS is our mandibular advancement splint, and it's a unique device that doesn't have a locking mechanism. It's designed to keep the mandible from falling backwards. It's actually built in a protrusive state so that when the patient engages the appliance, they'll first put in the upper and then seat the lower by advancing their mandible. And then when the natural elasticity of the ligament draws back, it engages the fin coupling mechanism here and doesn't allow the mandible to fall backwards. Again, very unique that it doesn't lock a patient into an occluded position. It's no lingual impingement, very elegant and sleek design, and clinically proven to be effective in treating OSA in mild and moderate cases, and even in severe cases. This is a device that patients are looking for, and they'll ask for it by name. The SomnoDent acrylic is using ball clasp retention. You'll notice that the devices side by side, the Flex and acrylic covers the occlusal surfaces. The Flex device has a little bit more bulk, encapsulating the tooth with suck-down retention. But both devices are adjustable and unique to the fact that they can be bilaterally adjusted rather than unilaterally. So it's actually very effective with TMJ patients, as well as people that need more comfort and freedom with range of motion vertically as well as laterally. Our SomnoDent MAS is adjustable up to 5 millimeters protrusive, and the adjustment device is actually in the upper posterior on the buccal, and it's one turn in the direction of the arrow is 1/10 of a millimeter. It's a very passive advancement for the appliance, and for the patient it helps with retaining comfort, and the compliant patient is getting that effective therapy and not titrating at larger intervals. That 1/10 of a millimeter, very minuscule and easy for the patient to use as well.
Joel, thank you very much.
Thank you very much, Dr. Mike.